chronic pelvic pain, horribly painful periods, problems with infertility, all these things are some of the symptoms that occur in patients who have endometriosis. Now, surprisingly, I find that not everybody knows about endometriosis or even what it is. I'm Dr. Monica, board-certified OB-GYN and mom of 3, and in this video, I want to describe to you what endometriosis is, what type of symptoms it can cause, what type of problems it can cause when it comes to things like fertility, and treatment options for this disease. Let's get into it. So first of all, what is endometriosis? This is a condition where the cells that should be in the lining of the uterus, the endometrial glands, end up moving elsewhere in the body. So if we go ahead and reference our hand-drawn diagram, this is the uterus. Everything in blue is just the general structure, so uterus, fallopian tubes, ovaries, vagina. This pink lining here is the endometrium. This is the very lining of the uterus, and this is what sheds off and comes out when you have a period. Endometriosis is when this tissue ends up elsewhere in the body. As you can see in this picture, this can sometimes end up being on the outside of the uterus. It can be in the fallopian tubes, around the ovaries. A common place is up kind of tucked behind the ovaries and the pelvic sidewall. It can be in behind the uterus, and it can have deeper infiltration into other tissues and structures. As a matter of fact, endometriosis implants can be found almost anywhere in the body, even described in places like the lungs or the eye. It's most commonly seen in the abdomen and in the pelvis, and the symptoms that come with this are pain, because this tissue responds to the menstrual cycle changes. When you're having a period, it has an increase in prostaglandin, which is an inflammatory type of marker, as well as other inflammatory markers that cause pain and irritation around it. It's not uncommon. It's determined to be present in about 6 to 10% of reproductive aged women. So how does this happen? We don't actually know how endometriosis comes to be. We have some theories, with the most common one and the most accepted one being the idea of retrograde menstruation, which just means that instead of the blood and the endometrial cells coming out during a period, they go backwards and come out the fallopian tubes. This is supported because most of the time endometriosis implants are found in that general area, around where the fallopian tubes come into the pelvis, around the cul-de-sac, which is kind of like the bottom of the pelvis. You could imagine that if it came up and came out of the fallopian tubes, that makes sense that that would be how it got there, because that's where we usually find it. But as I mentioned earlier, that's not the only place that it's seen. So that gives the idea to other ideas of how it might spread. The other two generally accepted theories for its spread are through the lymphatic system or just through the blood system. There's also an idea of it spreading through bone marrow. These are more supportive to when we have these really distant bits of endometriosis, like I mentioned in the lungs or in the eyes, because that would make more sense that those spread through either blood or lymph or bone marrow to actually get there. But ultimately, it's not really known. Now, what's significant about these implants, these endometriosis implants being outside of the uterus? Well, they respond to those hormones, those inflammatory markers and cytokines that I mentioned, and this causes inflammation and pain and dysfunction wherever they're placed in the body. Another important and kind of funny thing is that when we see this endometriosis in the pelvis, the amount that's there does not necessarily correlate to how severe the patient's symptoms are. So having a little bit of endometriosis within the pelvis, a few small implants can have very severe pain, while some people with extensive amounts of endometriosis may feel okay and not really have much issue. Also, depending on where it's located, you may have other symptoms because of its involvement, such as if it's on the bowel or if it's more deeply infiltrating either into the bowel or the colon. You may have issues with more painful bowel movements, GI upset and problems. There'll be people who have like rectal bleeding or blood in their stool because of the endometriosis that is infiltrated into the bowel or the colon. These are all issues that can occur based on where the implants are. Another very common symptom is called dysparunia, which means pain with intercourse. Now, these implants are very sensitive, so if they are located deeper in around the vaginal area or deep in the pelvis, intercourse can cause pain when it does press upon these implants. It's also common to have patients complain of kind of random pain. So yes, usually very painful periods, dysmenorrhea, which just means painful periods, but also pain in between periods is often seen with endometriosis. Depending on where the endometriosis is present, if it does invade into the bladder, there can also be bladder problems. So painful bladder spasms, sometimes blood in the urine because of those implants that cause some bleeding. Anything that has that implant on it has a tendency towards irritation, pain, and bleeding. Another very significant symptom of this disease is infertility, and it is a multifactorial cause of infertility. When I was initially in training, I think the main method that we knew that this would possibly cause infertility was because of its ability to cause scar tissue. Remember, this tissue is very irritating. So when there's irritation, there's sometimes is small amounts of trauma to tissue, and that is healed, which can cause scar tissue and adhesions. When this occurs in the pelvis, especially around the fallopian tubes, this can cause blockage of the fallopian tubes. But it's been discovered that there are actually multiple ways that endometriosis causes infertility. It's also toxic to sperm. The DNA that's in sperm that needs to be carried up to the egg and create an embryo is damaged by the presence of the endometriosis because of the harmful chemicals and substances that exist around it. Similarly, it's also harmful to the oocytes, so the eggs that are coming out of the ovary attempting to meet up with sperm, those are also damaged and harmed by the presence of endometriosis. It's also been found that endometriosis decreases anti-Müllerian hormone, which is something suggested of your egg supply and your ovarian reserve, and also has the ability to form ovarian cysts, which are called endometriomas, which can be harmful to the oocytes and the ovaries themselves. So as you can see, endometriosis can contribute to infertility through a multimodal effect by affecting many different parts of the delicate process of conception. So how do we diagnose endometriosis? I'll have patients frequently come and ask me, I say, hey, I would like to have a test for endometriosis, or I'd like to be tested for endometriosis. And there isn't really such a thing. There's no one blood test that can show if you have it. There's no one imaging modality that can show it in the belly. So we don't generally have a way to diagnose this. It's what's called a clinical diagnosis. So if we're hearing that you're having symptoms that sound like what I talked about, so you're having extremely painful periods, pain during sex, pain at other random times, or maybe if you've been attempting to conceive, have some of those symptoms and have not been successful. If we have a suspicion of endometriosis, we kind of have a working diagnosis based on a clinical standpoint. Now, we do ultrasounds all the time to check out the pelvic organs, and although an ultrasound, a CT scan, an MRI, they can't show endometriosis, sometimes on an ultrasound, if you happen to have an endometrioma, so one of those endometriosis ovarian cysts, sometimes we will see that on an ultrasound, and that can be suggestive that you may have endometriosis. However, the ultrasound can't truly say that that's what it is. It's often just described by the characteristics suggesting it could be an endometrioma. So it really ultimately is not diagnostic. It's just a little bit of a helpful tool to see if anything like that is there that may be suggestive of it. So then how do you diagnose endometriosis? And the gold standard for diagnosis is to visualize the endometriosis implants in the abdomen during surgery and to obtain a biopsy of that tissue, which is confirmed in the lab to be endometriosis. Now, oftentimes the biopsy doesn't really change things because as surgeons, we know what endometriosis looks like and we're generally able to identify it. But sometimes it's a little bit tricky. Although generally what you'll see is this kind of dark, powdery looking implant on the peritoneal surface, which is the lining of the abdomen. Sometimes it has actually a clear look to it or a reddish look to it. So if a surgeon's not 100% positive that that's what it is, that's when it's a very good time to take a biopsy and send that to the pathology to have it looked at and confirm if it's endometriosis or not. Now, we certainly don't just rush to doing surgery on everybody who we think may have endometriosis, because that would be a lot of surgeries, putting patients through a lot of risk for undergoing surgery. That's not really necessary. Generally, what we do if we think that endometriosis is a possible cause of your symptoms is we just go ahead and start treating you. So we, rule out any other obvious causes or easy to diagnose causes. And if we land on a working diagnosis of endometriosis, we just go ahead and start treating you. If you're finding this information educational and beneficial, please drop a like to help other people find this information as well. So what are treatment options for endometriosis? Most of the time, we're going to start with some type of medical management. And these are different types of medicines that we actually usually use for contraception. So different type of birth controls. They all work by regulating some of the hormones that will flare up endometriosis and making them a bit more calm. So the main hormone that's a little bit of the problem child when it comes to endometriosis is estrogen. Estrogen flares up that activity of those endometrial glands. It makes them grow, it makes them bleed, it causes the problem. So we like to implement using our good guy hormone, which is progesterone. Progesterone comes in and calms down those endometrial glands and makes everything more quiescent, thins out endometrial tissue so it doesn't proliferate and grow. Progesterone is our friend when it comes to endometriosis. Now, of course, we have all these prostaglandins and inflammatory factors too, so very basic, really first place to start is using medicines called NSAIDs, non-steroidal anti-inflammatory drugs, because we know there's an inflammatory process, so we're going to counteract that by taking Motrin, Advil, Aleve, naproxen. Those type of medicines can help at least calm down the inflammation, although oftentimes we need to add an additional hormonal treatment as well. So what birth controls are used to treat dysmenorrhea, painful periods, and the symptoms of endometriosis? Essentially all of them. So these can be combined oral contraceptive pills, progesterone-only contraceptive pills, progesterone-only treatments like Nexplanon, Depo, IUDs, a patch or a ring which has both estrogen and progesterone but at a more balanced amount. Any of these are options for treating endometriosis. We also have hormonal treatment options that are not used as birth controls and not used as contraception. So if you also desire contraception, you have to have some additional. But these work by, again, just disrupting that up and down change that comes with the menstrual cycle via their hormonal effect. So these are things like Orlissa, Lupron, Orion. You may have heard of some of these medications that are used specifically for treatment of endometriosis pain. So what if you've tried some medical options and they either haven't worked or they worked for a while and then wore off, or you've gone through a few different treatment options and you're still not really feeling like you're getting the result that you want? Sometimes at this point we do proceed to surgery, and the surgery has two objectives to it. First is diagnostic, so to go in and look and confirm, like, is there actually endometriosis here? If this is the working diagnosis we've been using but our treatments haven't worked, at that point it makes sense to go ahead and make sure that is actually the case and be sure we're not missing something else. The other point of doing a surgery would be to provide some treatment. So the goal of endometriosis surgery in a just kind of general basis would be to either fulgurate, which means to burn off, or remove the endometriosis implants that are present in the abdomen. So by removing these, we hope to reduce the amount of effect they have on the surrounding tissue. Now, this isn't just a straightforward surgery, because sometimes the implants are on structures that can't be removed or can't be burned, or they're an area that it's not safe to operate on, so we can't always remove all of the endometriosis. Also, the act of performing surgery and removing endometriosis can create scar tissue. When it comes to fertility, scar tissue is one of the issues that we have from the endometriosis that can affect your ability to conceive. So doing surgery has the potential to form more scar tissue. That's one of the risks there, is that we don't want to worsen the situation by also making scar tissue with removing the endometriosis. Additionally, if some endometriosis is there, we can see it. There's also the potential that there's somewhere we can't see it. So unfortunately, going and doing a surgery to remove the endometriosis or burn it or treat it, it just doesn't always take care of it. It's common to see some of the pain come back. It's common to still have pain afterwards. And unfortunately, subsequent surgeries to attempt re-removal are not always as effective as the first time around. It's definitely tough because it's not like a straightforward slam dunk type of treatment. Now, all of the treatments I've mentioned so far are what are called fertility sparing treatments. So if you use a birth control pill, it's reversible. If you have surgery, you still have uterus, fallopian tubes, and ovaries, you can still get pregnant. You still maintain your fertility potential. If someone's at the point where they don't care for future childbearing or they don't want to have kids and maintaining their fertility is not a priority or not something they want, we have the additional option of hysterectomy for treatment of this condition. Now, most of the time, a total hysterectomy with a bilateral salpingectomy, so total hysterectomy, again, means the uterus and cervix, not the ovaries, and taking the fallopian tubes, 60% of the time, they will be good to go. That will be curative for the pain and discomfort they're having with the endometriosis. However, we know that the ovaries secrete estrogen. We know that estrogen is kind of the bad guy when it comes to this disease. So sometimes additional surgery to remove the ovaries is also needed. Now, this is very much a patient-by-patient risk and benefit conversation, because we know that our ovaries have really important benefits to our overall health by continuing to have that estrogen exposure. So depending on the patient's age and how long until they'd likely go through menopause and their other health factors or other comorbidities they may have, they may greatly benefit from keeping the ovaries in, or they may benefit from having them taken out. Sometimes when someone has had a hysterectomy for endometriosis, we do then go back and remove the ovaries at a later time if they're not getting the relief that they need. So that's a general rundown of endometriosis, the symptoms it can cause, the problems with fertility, and I hope I also was able to give you an idea of how difficult it can be to treat it. Everybody responds so differently to medications, and the endometriosis situation can be dynamic and change as years go on. So it's very much an individual decision-making process to determine what might be best for you if this is what's going on. The main takeaway as well is, like I mentioned, a lot of patients haven't heard of this and don't know what it is. So if you're finding you're having severely painful periods, pain in between your periods, pain with intercourse, or you maybe just aren't sure if what you're experiencing is normal, please talk to your doctor about it and see if you might have endometriosis.